Hello, good morning, everybody. Thanks for joining us. Looks like everybody's starting to roll in. We are going to start in just a minute. It's always exciting to see the number of participants continue to tick north. But why don't we start? It is after 8 and it's just early. So let's get into it. Good morning and welcome to Eggheads, the Colorado Health Institute's monthly webinar series. We are excited to have so many of you with us on this bright, cold Colorado day. Thanks for being here. I'm Sarah Schmidt. I'm the interim president and CEO of the Colorado Health Institute. A couple of housekeeping announcements. Just want to let everyone know that this session is being recorded. We have also activated captioning for speaker remarks, which you can activate for yourself at the bottom of your screen. We will save some time at the end of our presentation for questions. That said, if you have something as we're going through the presentation, please just feel free to drop them into the chat, or you can also use the Q&A function for the webinar. And my colleague, Christy Ariano, will be responding throughout the presentation as we are able, but we will definitely circle back to those at the end of the presentation. And speaking of chat, we always like to kind of get things going here first thing in the morning, get a sense of who's in the room, how things are kind of what's on people's minds. So if you would, please just open up the little chat window and just type in who you are, maybe what you're interested in, what you're hoping to learn out of the webinar for today. Yeah, we'd love to just get a sense of who's in our virtual room for the audience. So please jump in the chat and share who's joining us today, maybe something you're excited about for this session. Oh, and it's always very exciting. See a couple great, so we have colleagues from UC Health, Healthy Air and Water, Megan, Emily from the Colorado Health Foundation. Welcome. Bob, good morning to you. Great. Oh, yes, everyone's getting fired up, getting their fingers going. Some of our local public health partners in here. Wonderful. Well, welcome, everybody. Colleagues from Colorado Access and Kaiser. So excited to see these familiar names coming up, and just everyone who's joined us for today. If you aren't familiar with the Colorado Health Institute, just to give you a little heads up of who we are, we're a nonprofit and mission-driven research and consulting organization. We advance the well-being of our communities through deep expertise and our implementation know-how. We work to simplify the complex, we provide context, and we advance policies that make a difference. Our public benefit work is funded by generous philanthropic supporters. We are very grateful to them. Organizations like the Colorado Trust, the Uzoma Foundation, and Caring for Colorado. Thank you very much for your continued support for CHI. We also consult with organizations across the state, including community groups, providers, state and local government, foundations, for analysis and strategic planning and facilitation and communications, and just kind of you name it, we love to do it. So if you want to be in touch with us, if you want to partner with us, because we're always looking to connect with more groups outside around Colorado. So if we can click to our next slide. Oh my gosh, I'm getting so distracted by the chat. I want to see what everyone has put in the chat and I can't. Focused. Last year, CHI, speaking of focused our philanthropically funded work, what we refer to as our health agenda, in 3 areas that we believe are critical to address if we are going to advance health and health equity in our state. Those areas are integrating systems of care, behavioral health, and climate and health. And that last one is the reason why we are all here today at this very exciting moment. As we get started, I want to give a shout out to our supporters who have really helped us advance our climate work, specifically Rose Community Foundation and the Denver Foundation. Thank you for your leadership in supporting this very exciting work that is moving into a new space beginning today. So if we can go to the next slide. Our climate work operates under the Acclimate Colorado umbrella, and the policy agenda we are launching today is at the center of the work. We'll talk about that in a sec. Give you a second to read some of these headlines up here. We know that Colorado's warming climate is hazardous to our health, that extreme heat affects the human body and increases environmental challenges such as air pollution, fires, and flood. Certainly many of you have experienced that firsthand. We also know the health effects of climate change are not experienced equally. People with the fewest resources are at the highest risk for climate-related illness and death. What we sometimes don't know, however, is what to do or where to start or how to work together to make the changes that we need. But thanks in part to the thought and the effort that a lot of our team and our dedicated community partners have put in to creating this policy agenda, which we are going to talk about today, we can't say that anymore. We know what we need to do, and we know how we need to move together as a community and as a state. So we want to get to it. And I'd love, it is my honor and privilege to introduce my colleague, Karim Ahmad, a director at CHI, who has fiercely led the Acclimate Colorado team, many of whom are on this call, many of whom are listed in this policy agenda. Take it away, Karim. Thank you.
Thank you, Sarah. Good morning, everyone. My name is Karim Ahmad. I'm a director here at CHI, and I direct our Acclimate Colorado work. I've been working on climate and health work for almost a decade myself personally, and for over 5 years at CHI. And to get us started off, I want us to really think about, we asked this question of, what do you value most that climate change threatens? We asked this at our Hot Issues in Health conference just a few months ago to over 200 folks in the audience. And I'm about to display actually a word cloud that was created by the audience. But I'd love for you all to just share one to three different words that things that you value in your life that climate change threatens. For me personally, to get us started, I always talk about sort of my 3 Ps. It's like the people and the places and the things that I like to play. So the people, it's my family, my friends, my pets, ensuring their health and safety. When I say play, I mean, I love the outdoors. I'm a Colorado native. Being able to play soccer, play outside, having clean air, go outside for a run. And then the places, as I said, I'm a Colorado native. I love our nature, our snow, our rivers, our lakes. I don't want to see those things threatened. Being able to go outside for a hike, who remembers when we were all staying at home towards the beginning of the pandemic to stop the spread, and then we couldn't even go outside for a hike because the wildfire smoke was so bad. So feel free to share a few of your thoughts in the chat. These were some of the most commonly shared words and ideas at Hot Issues in Health just a few months ago. Family, health, water, nature, home, things that are very near and dear and close to home. And I'm seeing some things in the chat already: peace and prosperity, people having peace of mind, being able to protect family and children's future, people really thinking about those that are close to them and that they love. So feel free to keep sharing those in the chat, and keep those. We'd love for you to really keep those values close in mind today, as we'll be talking about 5 areas in our policy agenda today that are going to be used to really drive programmatic and policy changes that are aimed at protecting those things and those people and those places that you value most dear. So really quick, an overview of today's session. I'm going to quickly talk about why create this policy agenda? Why now? Sarah really emphasized the impetus to really drive this work at this important juncture where we are in Colorado and globally. Then we'll talk about really the purpose of the policy agenda, the folks that helped us craft this, community organizations, and then quickly we'll go over the process. And then we're going to provide some examples of the 5 key categories in the policy agenda with some strategies under each. And then we're going to be joined by my colleague, Juan Madrid from Green Latinos from our action team. And we're going to really spotlight the really important community engagement work that they're doing related to climate and health, and how they're looking to drive this type of work forward. And then we'll talk about what's next, which is implementation. How do you take this from paper into action? We'll go through that, and then we'll have some time for questions from the audience. So for those of you that are not familiar with our Acclimate Colorado body of work at CHI, I wanted to really quickly provide an overview of the 3 A's that drive our work. First, we've spent over almost 6 years pioneering climate and health indices and maps at CHI, really assessing risks and strengths of community adaptation. This last year, actually, it was last July, we launched an updated health and climate index with new data and new insights and new mapping tools that allow you to really make sense of what do the harms of climate change look like in your local community. And we'll provide links in the chat to these different resources. Second, we've really began to align major actors in this space through our Acclimate Action Team, which really brings together dozens of disciplines, folks from government, nonprofits, community organizations, advocacy, you name it. We even have a mental health therapist that focuses on climate change, Amanda Rebel out of Boulder, Colorado. We have folks that are really thinking about climate change from all different angles and how they impact health. And then finally, what we're excited to share today are advancing this work through what we're debuting today, which is a first of its kind climate and health adaptation policy agenda for Colorado to advance this work. But advancing this work cannot happen with CHI alone, nor with our action team alone. There are dozens of community organizations, local public health agencies, state leaders, advocacy organizations, and then most important, community that we're going to need to do some very intentional engagement with over the next few months and next few years to advance this work and make it a reality. So why did we decide to craft this policy agenda? Why have we put this thing together? Well, the timing of more frequent extreme heat days, more drought, poor air quality, more wildfires really undergirds the need to act, as the focus on protecting health and well-being of disproportionately impacted communities is really heightened at this point. We created this because Colorado needs a tangible, achievable, measurable, and meaningful set of policy strategies that will improve the health and well-being of Coloradans and protect them from climate impacts. And because we want everyone who's working in this space to see themselves in the work. There's a role for everyone, no matter where you're coming from this work, whether you're in health, working in health, environment, community work, you're in the policy space, private industry, whatever. People will be able to use this policy agenda to really identify actions and strategies that they can support or champion over the next few years. And other things that really undergird what value this brings is the policy agenda will elevate the health and adaptation conversation in Colorado's climate change policy space. Adaptation is becoming a more central focus in our state, and we really want to elevate that. And it really also creates a plan to create and maintain momentum for those adaptation planning conversations and policy changes that we absolutely need to see to protect our communities. Really quick guiding principles that really drove the development of this policy agenda as we put this together this last year. Prioritizing communities that are disproportionately harmed or are sensitive to climate change, and folks that are currently or historically excluded in the adaptation policy space. That's sort of first and foremost absolutely important and a guiding principle. Second, really developing strategies, policies, activities, programs that protect human health while at the same time are mindful of mitigation. You can't just give everyone in the state a not energy efficient air conditioner and say we're done. It's got to be done with a balance of adaptation and mitigation in mind. Third, advancing equity in climate resilience planning is going to be important. And when we say that, we mean Driving implementation by really breaking down barriers that prevent communities who are disproportionately harmed by things like extreme heat, poor air, and so on from thriving. It's removing those barriers. And then we want to ensure that any policies that are going to be driven from this policy agenda are going to be done with community, are community driven, and elevate community voices and needs. And finally, ensuring language justice is important. We want to practice language justice by ensuring health and community organizations and folks are equipped to communicate with people from different backgrounds and languages. We're going to go a little, really quick over the process because we want to go through actually the content of the policy agenda. But the process, in short, included a literature review and analysis. Team CHI, we used our Health and Climate Index tool, as well as an assessment of over 70 research sources, articles, and resources that were reviewed in this process to really drive sort of what are the areas of climate adaptation policymaking that are relevant. Next, we did extensive several dozen key informant interviews with folks from community, with community-based organizations, with leaders in the climate and health space, really to inform the development of various policies initially. And then finally, we worked collaboratively over this last year with our Acclimate Colorado action team, who we convened and facilitated and continue to, now that we're driving the implementation of this work, to really identify and put forth promising policies and practices that can make a difference for health. This action team is made up of a really diverse group of cross-agency, cross-sector, cross-disciplinary leaders in this space who come from academia, city government, mental health, economic development, energy, folks doing work with indigenous communities of color, agriculture, really all angles of health and climate work. And this, I just want to give a really important shout out to the action team. I know some members, I saw some of the names in the chat, are on the call today. Thank you so much. I cannot emphasize how grateful CHI is for the work that you're all doing in your own capacity, and for the time and thought and effort and collaboration you continue to provide for this work to drive it forward. Today, we're actually going to hear from Juan Madrid from Green Latinos. That's why his name is highlighted in green down there. So adaptation to the changing climate it's a global challenge. The work is complex, but it represents a critical opportunity to improve the health outcomes for Coloradans that are most impacted by a changing climate. This policy agenda really offers a place to start by identifying 5 categories for developing and really advancing practical solutions. These five categories include growing Colorado's climate adaptation planning and response capacity, really improving and investing in infrastructure, really thinking about sort of the folks that are doing this work on the front lines. So thinking about the workforce capacity for folks that are going to and are already thinking about climate and health adaptation response. It wouldn't be a CHI presentation if I didn't say we need to improve data and research and ensure that the insights that we're gathering and tracking on now and in the future are being improved. And then finally, we have to ensure that we're developing and sharing communications tools that practice language justice, that practice thoughtful engagement. And I'm going to dive through each of these 5 categories now with a few examples. There's actually 26 goals and 34 strategies within all of these 5 categories. We're not going to be able to get through all of them today, but I'm going to give a couple examples today. And I invite you all to read through the policy agenda and reach out if you have questions. So as I said, each of our 5 categories have several pieces of work. I'm going to go through each one so just to show why it's important and sort of provide an example of the type of work that needs to be done. So first, growing Colorado's climate adaptation, planning, and response capacity. Why this is important to health? Well, we have state and local plans for all sorts of risks to people's health. We have prevention plans for diabetes, emergency response plans for hazardous material spills, and now we need health and climate adaptation plans. Making a plan is really the first step in starting the work to protect ourselves from hotter temperatures, from poor air. So how do we do that? You'll see in the policy agenda, there are several strategies actually under this goal. One of them is really centered on creating adaptation planning templates. So ensuring that there's sort of a template for how cities, counties, municipalities can create and update and implement health and climate adaptation plans. This work is being done in a lot of communities already. So the reason that we're trying to sort of emphasize this coordination of this is adaptation plans provide guidance for and really include feedback from state and local governments and community and non-governmental organizations, including health systems and businesses and community groups, to ensure that there are local plans put in place that protect people's health and are localized in terms of what the solutions look like. So creating health and climate adaptation plans locally will be important. That's just one example of a strategy in this category. Second is infrastructure. And this is important because our infrastructure really in the Rocky Mountain West here in Colorado it's mostly built to keep people warm in the summer, but not always cool, or rather warm in the winter, but rather not always cool in the summer. And our infrastructure policies have the same problem. But the science tells us that extreme heat can be both a chronic and acute health risk. Sometimes it's so hot, the human body just needs a place to cool down. And some of these strategies that we're putting together, this strategy specifically is the idea to put forth a right to cool. So passing a policy, working with groups that are interested in doing this, and this work is already underway. There are already groups, even on our action team, that are thinking through this. Passing a policy that would ensure homes and buildings and dwellings have cooling standards is a direct way to protect the health and well-being of people from extreme heat events. Who remembers where I think we had like 2 or 3 weeks where it was over 90 degrees in the Denver metro area last summer? Those extreme heats can pose a threat to people's health, especially people that don't have the ability to cool down. And it's becoming more common. Third is really thinking about our workforce. So we need to make sure we have trained people to keep us safe from different climate impacts. Everyone from wildland firefighters to public health workers to weatherization techs. And we need to keep those workers safe themselves. A lot of them work outdoors. This matters for health because a lot of workers are starting to face, as I said, new on-the-job hazards, namely extreme heat. And how we think we can address this is by updating worker safety protocols and rules for anyone who's exposed to heat, either in indoor or outdoor jobs that can get super hot. So pushing forth policy to update workforce safety protocols for outdoor workers and folks at highest risk for climate exposures would ensure the safety and health conditions for hundreds of thousands of Coloradans that work in these kinds of jobs. So again, that's one example of a strategy in this section. Next is improving data and research. So the connection between climate change and health, it's not new. We've been talking about it for years, if not decades in this space, but there are still a lot of gaps in our knowledge, and we need more research, we need more information, and we need more analyses to really understand the key health impacts in real time and over the long term. We have to be able to track this over the long term. We can start, and we are already starting to work on this right now. And actually at CHI, we are. The policy agenda calls for updating data collection instruments to establish data trends on climate and health. And we're actually, we're getting ready to go into the field with the 2023 Colorado Health Access Survey. This is CHI's biennial health access survey. And we're excited to announce that we're actually going to have several new questions related to climate and health. So this is actually an area of work that's already starting to happen. And we know at the state level as well, there are new data collection tools like the EnviroScreen tool from CDPHE and other tools that are continuously being updated, refined, and made better. And then finally, communications and education. This matters for health because some of the people who are being harmed the most by climate change often don't have communication and education materials available to them. When climate change is discussed as an environmental concern, it's too easy to default to the framing, to slip into the kind of into a wealthy, privileged, and often a white point of view. And we know some of the biggest health harms will be on people who aren't wealthy and might not speak English and probably don't have a lot of political power. So the policy agenda calls for equity-driven communication materials. And what do we mean by that? Well, part of it is expanding climate communication to reach communities with different political beliefs, folks who live in different geographies of the state, folks with different languages and cultures and backgrounds. We know our friends at CDPHE are already starting to do some of this important community engagement work. We also know there's an opportunity to create more tailored and easy to access climate materials. So to spotlight how some climate adaptation and community engagement work in the climate and health space is already underway, I'm going to pass it off to Juan Madrid from Green Latinos. And he's actually one of our action team members who helped collaborate and craft this policy agenda to share more about his organization's work. So Juan, I'll pass it off to you.
All right. Thank you, Karan. Can everybody hear me?
Yes.
I'm coming to you by phone. Okay, perfect. And
Are you there, Juan?
I believe
I don't know. Juan, I think you're cutting out. Can you hear us? Apologies for the technical difficulties.
okay. Can you guys hear me?
Okay, now I can hear you, Juan.
Okay. So Juan Madrid with Green Latinos, and was going to highlight really how our work at Green Latinos is helping to disproportionately impacted communities that are already addressing climate change issues, whether that be the Metro Front Range with air quality issues from tailpipe emissions, or whether that be our community members from the Western Slope that are working in extreme heat. The things that we do is we engage with community to see where our community members, often who are monolingual Spanish speakers, how they're being impacted, and then uplifting the voices and the experiences that they are having. One of the big things we look at is we look at historically marginalized and disproportionately impacted communities such as Commerce City and Northwest Denver, which sits in what we call an inland port, where you have many facilities with oil and gas, and you have trucking industry, and you have freight industry, you have heavy rail that is coming in through that corridor, and those communities that are living in those spaces are often experiencing greater increases in respiratory disease, and so highlighting those concerns, working with the community, working with community groups like Cultivando, which is a grassroots organization in Commerce City that has worked hard to get fenceline monitoring from Suncor and started to provide their own monitoring to address their health issues and to understand the health impact. So at Green Latinos, we're working with those communities to address those concerns, and that's where really a lot of the goals and tools in the plan here help address that, but really emphasizing that education and outreach component, language access component. And then often these communities aren't sought out for public input. And if you don't have an opportunity to provide that public input in your native language, or there's a space that's not provided for you to feel comfortable to provide, that becomes a challenge. So Green Latinos works with CPHE on how they can provide better and more authentic engagement with community members, whether that's compensating community members in the non-traditional work hours, so meetings after 5, providing child care assistance so that these folks can get to the meetings and be able to participate, and having that language access available as well, having that translation and interpretation, and whether that's an in-person or if it's a Zoom, often folks think, okay, I'm going to convert my Zoom slides or I'm going to have an interpreter. And those are great starts for the conversation, but that's how Green Latinos is engaging with community, not just in the Front Range, elevating Latino, Afro-Latino, and Indigenous voices, but across the state, whether we travel down to San Luis and talk to folks there about transportation issues and how transportation issues are impacting not only their health, but of equity and access to health. So those are some of the areas in which we are addressing, working with communities that are living in mobile home parks that are experiencing poor water quality. And then they go to the state, and the state says, well, that's a municipal issue, and the municipality says, well, that's not a municipality issue, that's a private water rights issue because the water park landowner is the owner and the one who's providing that water source service, right? So often community members, especially if you have language barriers, aren't able to get through some of these challenges. And so we work with our community members, and we work with partner organizations like Conservation Colorado and their Protégete, which is also their Latino outreach component for Conservation Colorado. Those are the areas within which Green Latinos is working. And Green Latinos is also partnering with the School of Public Health. Recently, we partnered with Dr. Dickinson out of the School of Public Health to help us identify 180 polluters in the North Metro Denver that were self-identified but not being looked at by CDPHE. And so they created a report that was titled the North Denver Air Report, and it looked at, again, organizations that are self-reporting air quality violations that aren't being picked up by CDPHE. And so working with the School of Public Health to get the students there, researchers, into the community and to work with community members to produce reports like this.
Juan, I think we lost you again, but I think we were able to get a good picture of sort of the work that the important work Green Latinos is doing. In summary, I think it's important to emphasize they're doing a lot of work in the sort of field of environmental justice. They are doing a lot of thoughtful, authentic community engagement, especially with Spanish-speaking, Hispanic, Latino, Latina communities throughout Colorado. They're doing a lot of collaborative partnerships with groups like Cultivando out of Adams County, as well as the School of Public Health and other local CBOs to ensure they sort of have this both support of a grassroots and a grass tops approach to their climate work. And Juan was also sharing sort of how this policy agenda gives some direction and can help elevate some of the priorities that Green Latinos also shares with this work. So Juan, thank you so much for sharing. Apologies for the bandwidth issues. We'll have to do some sort of follow-up Q&A with you after this and connect you with folks that might be more interested. Juan's his information is up on the screen if folks are interested in getting in contact with him directly with any questions. But thank you so much, Juan, for sharing about the work that Green Latinos are doing. So we want to, before we get to Q&A, we want to quickly share what's next. What does implementation, or what do the next steps for this work look like? First, and we're going through this process right now, is prioritizing and really thinking about what's the low-hanging fruit. We've got 34 different strategies in this policy agenda. What are the early wins? What are the impactful areas of the policy agenda that can be advanced in the next year or two? So we're working with our action team to identify those areas right now. We're also looking to identify champions, not just on our action team, but we're looking to do some outreach to community and different organizations that can help really drive these policy changes and drive these policy strategies to really make them a reality. Outreach, in terms of outreach, we're over this next few quarters and honestly the next few years, but starting in the next few weeks, we're going to be doing an outreach strategy that's really geared towards thinking about who are the communities that we need to reach out to, who are the folks that are already doing some of this work so we can elevate and amplify this work, and who are the folks who are in government or in local cities, local organizations that can take on some of this work and work collaboratively to advance some of these policy strategies. And in doing that process, outreach is one thing, but ensuring that the work continues and is collaborative is another. So the ultimate marker of success is that some of these policy strategies are adopted, and that's gonna require a lot of collaboration over the next few years. We've actually created a tracker for all of the policy strategies, and we're going to be tracking our progress on implementation. This isn't just going to be a PDF that lives on a website. This is going to be a living, breathing, active document that we're going to be tracking progress on with all of the strategies. And we're going to be convening our action team over the next, the next year and the next few years quarterly to really track on that progress and really see how the work is going to advance. So all of that said, in kind of a timeline, is right now we're in Q1. We've launched the policy agenda officially today, and we're identifying that low-hanging fruit. And we invite folks to reach out to us if they have thoughts, ideas on how on areas of the policy agenda that can be advanced in the immediate, or if there are areas in the policy agenda that are going to take a longer time to advance, but we need to get started on now, please let us know. But over the next few quarters, we're going to be doing that outreach, that implementation, and we're thinking through what could be a health and climate summit potentially in 2024. One, to sort of have a public convening to really bring forth updates on how implementation is going on the policy agenda, areas that we might want to elevate, opportunities to elevate community voice or community advancement of this work, and to really just bring forth new knowledge on the progress of this work. So there's a lot to come, and we've already we've already got a lot of work to do starting now and moving forward. So how can you all on the call get involved, and those that you work with? Well, there's sort of a spectrum of how folks can get involved. First of all, we'd love for you to read and share the policy agenda. Really take a critical look at the different policy strategies we have in there. And let us know if there are areas that you're interested in learning more about, areas that you might already be doing work on, and areas that you might be interested in advancing. And we'd love to connect with you and connect you with folks that are doing the work. Second, you can reach out to CHI to learn more. Always happy to have a great conversation about this work. And as I said, if there are areas of work that you are interested in really leading, take a look through the policy agenda. If there are policies that you'd like to champion, or there are organizations that would be really strong champions in this work, let us know. We're looking to see if there are folks that want to join the action team. We're always welcoming new voices, new perspectives, and new organizations and folks who are doing this work. And then, we're going to be really thinking about sort of how do we intentionally engage and inquire with community to make sure that it's one thing to have sort of these evidence-based and promising practices built into these policy strategies, but that's step one, right? Actually crafting and fleshing out these policies and making them a reality is going to require engagement and having this work driven with community and by community. And then finally, we're looking for folks to support the work. This is really labor intensive, really complex work, and we want to ensure, especially as we're continuing to engage more and more with community-based organizations, that we have the capacity to support this work and advance this work going forward. And up on the screen, there's a QR code. You can also just go to colo.health/climate list, and you can sign up to our Acclimate Colorado sign up list to receive updates on the work that we're doing and to get involved. So with that, I'm going to move us to a Q&A. And before we take questions from the audience, I would love to hear from any folks that might want to come off mute. There are a couple questions that we're thinking about here at CHI, and one is really, we have 80 people on this call. Where do you see yourself or your organization or your community in this policy agenda, and how can CHI and our action team potentially elevate or support your community or your group's needs? Feel free to respond in the chat, and you can actually raise your hand so we can unmute you if you are interested in responding. And then we'll take questions on the policy agenda. But I'd love to just hear from a couple folks on like how this can help their work and where they might see themselves in this work. And then again, yeah, feel free to use the raise hand feature if you are interested in sharing some thoughts. And if folks do have questions, we can start taking questions as well.
Feel free to raise your hand. We'll take you off mute. You can also drop your question in the chat. We can find you that way, take you off mute, or we can just read your question if you drop it in the chat.
And it looks like Mandy Ashley has her hand raised. Morning, Mandy. Good to see you.
Hi, good morning. So health alliances across Colorado, I think, are just beginning in this work. So yeah, you can help us in ways that you already have by providing a policy agenda for us to start distributing and continue the conversation with the community-based organizations that we are working with. So thank you so much.
Awesome. Thank you, Mandy. And yeah, please let us know if we are always up for giving sort of tailored presentations of the policy agenda, depending on who we're talking to. So if the health alliances are interested in having a conversation about this, or having a discussion about sort of what what they can do in this space, we're happy to have it. And thanks for raising that. Appreciate it. Looks like Judy Danielson has her hand raised.
Thank you very much for this. Together Colorado, which is interfaith, interracial organization and congregations, is very interested in our health committee. We've been very interested in part of the stakeholder group working on Representative Basenecker's bill that he has brought forward this session. House Bill 1209, to study a universal health care system that would provide financing for every person's health care in this state. And I think that this could be a real advantage if we actually got a bill and set up a plan for Colorado to provide healthcare for every person in Colorado. And we have been very interested in the justice side of that, that every person be allowed access to have healthcare, because there are so many that don't. But obviously we're going to need more healthcare providers. And how that gets built into such a plan is one of the questions. And I wonder how this plan can help to flesh out some of that. The hope is that this will get funded so the School of Public Health can continue the work to devise and go through all the details that would be required to know to do so. But we are going to need more providers, obviously, to provide all this care if we do eventually pass such a bill. And I hope we will, and I hope CHI can be assisted.
Yeah, thanks for raising that, Judy. Of course, like as we're talking about climate change and environment, the notion of people having access to care is important. Ensuring that people, especially in the event of either a wildfire, poor air quality, if there's a heat wave or whatever, ensuring that people have access to high quality care is important. And yeah, thank you for raising that. If there are opportunities for us to, please let us know if we can help you. As you mentioned, you're looking for folks to inform the research on this work. Please let us know, and we're happy to engage with you and explore that further. Appreciate it. What other questions do people have? And it can be specific to the policy agenda. It can be about how you might want to get involved, anything.
Is the policy agenda online?
It is, yes. And we can actually drop a link in the chat. Yeah, I think our communications team will just send you a link in the chat in just a moment.
There is a link in the chat right now. We will certainly re-up it. But for everybody who registered for this webinar, which I assume you did since you're joining us today, we will also be sending out a follow-up email that will have both this link as well as some follow-up items to other materials we've done.
And I actually got a question from Emily Rader. Hopefully I'm saying your name right. She said she's curious to learn more about the action team and ways to be involved in that. Yes, please. Happy to connect individually, Emily, if you'd like to do that. If you'd like to talk about that right now too, I'm happy to. But yes, please, we're always looking for new voices, and whether it's on the action team or it's in working on elevating or advancing some of these policy strategies, happy to connect.
Carm, I also want to call your attention to a comment in the chat from Lisa Romero.
Yeah.
Lisa, I don't know if you want to come off mute or if you just want me to read it. All right. Lisa says, I know that CHI does really great comprehensive work, but there are voices in this policy work or in the climate health space in general that have been harder to reach or engage with. If so, which groups are less well represented, and any thoughts on how to bring them in?
Yeah, that's a great question, Lisa. And good morning. It's good to see you in the chat, and awesome to have you here. Yes, there are all so the groups that there are multiple groups that we need to sort of have in mind, right? There are folks that I think there's over 600,000 people that are monolingual Spanish speakers in Colorado, for example. Thinking about language justice, thinking about how we communicate. I think there's been a lot of really good community engagement work from the state and from local cities on environmental justice, on climate change in general. And I think there's a significant opportunity to engage on sort of the connection between health and climate change with a lot of those communities, especially in the metro area. Outside of the metro area, it's also important. I think there's a significant opportunity to engage with folks that are in more rural areas of the state, folks that are, agricultural workers, ranchers. Drought is a significant issue outside of the metro area, and I think there's a significant opportunity to engage with them. We actually have people on our action team from the Rocky Mountain Farmers Union that are doing some of this engagement in the field of actually like mental health, and working with those communities. And we're looking for ways to sort of advance climate work in those spaces as well. So that's a great question. That's two examples of groups that we'd like to see more engage with, and they have been difficult to engage with. But there are the first step is sort of understanding what organizations already have that trust built with community and working with them, and starting that engagement. So thank you for raising that. So that is a absolutely pivotal question in this work, especially at this juncture of driving this from driving it into implementation. Thanks for that, Lisa. And then Ray, I see Ray, welcome, good to have you. This question is, what's the best way for advocacy groups to partner with CHI around specific policy recommendations in the agenda? Yeah, so it's going to vary depending on how the advocacy group is interested in advancing a policy recommendation. If they're looking to craft legislation, or if they're looking to just learn more about a specific area of research, CHI is available to put together research materials, to pull the data, to inform really your strategies and your advocacy work. CHI, of course, we don't do advocacy work as a sort of neutral convener, but we are happy to have those conversations and really meet those advocacy groups where they are, in terms of if they need research insights, if they need connections to folks that are working in this space, if they need, we're always happy to do neutral testimony if there ends up being legislation. It just really depends on what the group's needs are, but that's a great question, and we're happy to think through that with them and with you. I'm seeing some other comments. Nina says, do you have modeling data predicting that Colorado may experience more nights where the temperature stays elevated during extreme heat waves. We want to be able to have plans to respond to such events if they are becoming more likely. So we actually don't like personally have data to demonstrate that. Nina, your point is well taken, because in climate and health sciences, I think it's, if temperatures do not drop under 80 degrees Fahrenheit at night, the body actually can't like rest at night. And if the body cannot rest, then you're going to wake up with anxiety. You're going to wake up with all these different health problems, depending on whatever health conditions you might have. So that's an important point to really drive. I will say that there are, there are efforts, and we actually, in our policy agenda, we have a few efforts that are sort of geared towards identifying when can alerts be sent to people when there are going to be significant heat waves. What are sort of the trigger points for ensuring that people are warned about those incoming heat events. But the data, we don't personally model the temperature data at CHI, but we're happy to sort of think through that further. We have people on our action team that actually, like, their bread and butter is thinking through extreme heat and protecting people. Cool.
Karam, I'm really excited by all of these questions.
Yeah.
We are close to time, but I'm wondering if perhaps we can get one more. Mandy Ashley had a question about, has climate change been prioritized in community health needs assessments with health systems or health departments? And I know, Karam, if that's not something you feel comfortable addressing, we have other folks on the call, but I just thought that was really interesting, and then we probably need to wrap.
Yeah, that's a good question, Mandy. I don't want to speak on behalf of an organization, but I've worked on a community health needs assessment with a health system, and climate change came up as one of their top 5 priorities. So this is beginning to come up in those health needs assessments, depending on where those health systems operate, and happy to chat more about that, or connect you with health systems that we've worked with on CHNAs, because CHI has done some of those. That's a great question to, there it is, Lisa, it's Kaiser. She said it. Yeah, that's the group that we've worked with. And thanks for sharing that tool, Lisa. Great, well, thank you for the questions. Please do not hesitate to reach out. My email is, here we go, is up on the screen. If you do have questions, you can reach out to me directly. I want to give a quick shout out to our March 23rd Eggheads. The next month, we're going to have our group at CHI focusing on 2 timely topics, so childcare and prescription drug costs. So stay tuned for that, and you can find the link to register for that on our Eggheads page on CHI's website. I want to thank you all again for joining us today and asking such thoughtful and critical questions that will help us refine and advance this work moving forward. We're at a critical juncture in our state. I mean, it's super chilly outside today, and we want to make sure, when we do have these extreme temperature events, and when we do have all these sort of climate impacts that do happen in Colorado, we are prepared to protect the things that the people, the places, and the communities that we value and hold dear to ourselves. So please reach out if you have more questions about the policy agenda. We appreciate you all joining us today, and we're just getting started.